For all the latest updates, subscribe to News 9.
Hello, you're watching News 9 Digital. I'm Surat Suresh. Well, a shocking day for Karnataka on Thursday because it recorded a biggest single-day spike of 1,502 new COVID-19 cases and 19 related fatalities as well, taking the total infection count to 18,016. Well, the state government recently also held a discussion with the experts from various sectors to discuss a possible strategy to counter the increase in the cases as well. But seems like everything is working out well for Karnataka with respect to the revised guidelines for home isolation. Yes, now the central government has revised its home isolation guidelines in the wake of the steady alarming rise in COVID-19 cases in the country. So this is mainly for the asymptomatic patients here. So what are the guidelines like for the asymptomatic patients? Well, firstly, the asymptomatic patients will have to quarantine themselves at home. This is to ensure that they do not contract the disease or they do not spread it, because they will not know themselves whether or not they have the disease or not. Well, asymptomatic positive patients will be included on the list of mild or pre-symptomatic cases. This is what has been decided. Well, the patients will be advised to isolate at home and self-monitor their health for further 7 days. Well, the first 7 days is quite crucial because they will not show any symptoms. So as soon as they get themselves tested, it comes out positive. For the next 7 days, they will have to monitor. That includes the oximeter. They will have to check for any of the symptoms like cold, cough, fever, breathlessness, and any of the influenza-like illness. All of this, they will have to check themselves for the same. Now, patients with very few symptoms or mild symptoms can choose home isolation if they have the required self-isolation facility. If not, if they stay in a PG or if they do not have a place where they can isolate themselves and they do not further spread the virus, then they can go into institutional quarantine or government arranged quarantine beds. Now, they can avoid contact with their family members as well. This is quite important because you do not want to spread this particular virus. Now, these are few of the patients who are asymptomatic and probably within the age group of 20 to 40. But patients suffering with HIV, transplant recipients are not eligible for home isolation, and the same holds good for elderly aged more than 60 years old. But they will first go under evaluation if they are fit, they do not have any of the comorbidities like diabetes or hypertension or several other ailments, then probably they can be under home isolation. But at the same time, they will have to have someone who will be taking care of them 24/7. So this is criteria which the government of India has put forward. At the same time, all of their family members will be there. That is a crucial point. So they will have to be administered HCQ as well as per protocol. So it is very important. The person will be taking care of the patient as well as the people or the family members who will be staying in the same house. Now, even Karnataka government has prepared a draft of their home isolation protocol, which is likely to be released in the coming days. We do have the copy as well. Most likely, it will adhere to the same guidelines which the government of India has put forward. So, yes, a lot of criteria is coming forward for asymptomatic patients because that was a cause of concern, because many studies have shown that 90% of them will not know whether or not they have COVID-19 symptoms or not. Well, Dr. Giridhar Babu, who's an epidemiologist as well as who's part of the Karnataka COVID Task Force Committee, has gone ahead and said that there are several instructions that people will have to follow once they go into home isolation.
One has to take nutritious food, sleep well, not worry too much. These are the most important things. On top of that, there are medicines which are allowed as per the protocol that they'll have to continue taking. Every day, they need to report as per the protocol, the health team which is in charge of monitoring them in the mode and manner in which the guidelines say, and follow the entire procedure as per the guidelines are. So this is not very complicated. This is very easy. It's just staying at home in addition to having some responsibility of taking some medicines and taking care of yourself.
Doctor, how will they even know that they have recovered? Because the government of India has said that testing is not required on the last day, which is the actual protocol. So how will they actually know that yes, they have recovered from the virus and they do not have to stay under home isolation anymore?
Whether it's symptomatic or asymptomatic, there is no required test to be done at the end of the hospitalization or the home isolation. The assumption under this is once a person is no longer symptomatic, then even though if the viral load is there, viral shedding is limited, which means they are least likely to transmit the virus. So therefore, it will cause additional burden on the testing. But as per the Government of India guidelines, there is no requirement, and this is also scientific as per the available evidence now.
What would you like to say to those asymptomatic people, whether or not they should choose home isolation or should they actually be hospitalized?
Yeah, Suraj, this is part of any natural progression of an infectious disease outbreak. And in terms of surge in cases, what we need to understand is we need to decongest hospitals. So home isolation is a good thing. In addition to that, we should make sure that people do not crowd the hospitals in terms of requiring the beds. Sometimes hospitals also give something called hospital acquired infection. So one has to be careful in looking at benefits and risks.
Well, many thanks, Doctor, for joining us with all of those input. Well, clearly, there you saw. Many of you might be scared as to whether or not you are asymptomatic and probably are worried what will happen to your close ones. Do ensure that they are safe. Isolate yourself at home, but also do ensure that you maintain social distancing and also follow all the instructions which the doctor has given, as well as adhere to the guidelines which the Karnataka government will be issuing in the coming days. Also, for your benefit, we have also left a helpline number bottom of your screens. You can also call them up, and if you have any more queries, you can ask them. But again, we reiterate, we would like to ask all of you to adhere to the guidelines which the government of Karnataka, government of India has already issued, and also at the same time follow the mantra: social distancing, wearing your mask, maintaining personal hygiene is the need of the hour. Well, if you have liked this video, do hit the like button, leave your comments in the comment section below, and also subscribe to News9 Digital on all the social media platforms. Until next time, thank you.